Hello and welcome to Tik-Tokophobia. I'm JJ, and this is the YouTube version of the podcast that Alexia Leachman and I co-host. Alexia is the world's foremost expert on tokophobia, which, according to the dictionary, is an intense fear of pregnancy and childbirth. And we would say it's much more than that. It's a reproductive anxiety disorder and probably an apex anxiety disorder. Thing is, not very many people know about it, so we're here to talk about it and to explain what's going on. Now, today is a little bit of a different format for us because we have a guest with us, and he is a phobias expert. He's Christopher Paul Jones, who is a Harley Street phobias specialist. He has clients all over the world, and he's also written this book. It's Face Your Fears, 7 Steps to Conquering Your, if I can show it there, your phobias and anxieties. Didn't show up very clearly there, but anyway, that's his book. He really does know his stuff. I had him on my radio show a couple of times, I think, actually, and he's a great guest. So we thought it'd be fantastic to get Christopher on to talk about fears, anxieties, phobias, that sort of thing. So without me waffling on anymore, let's introduce Christopher. And Chris, it's fantastic to have you with us today. And what I'd love to ask you about is the difference between phobias, anxieties, and fears. So what are your thoughts on that?
Well, thank you for having me. Yeah, I think we have like the technical definition and then what people tend to use. So technically, a fear is something you're afraid of. So that can be, oh, I don't know, I don't really like flying, but I'll have a couple of beers and get on the flight. A phobia technically is where you just see that thing or think about that thing and have an instant reaction. And so that's the technical definition, but they tend to become interchangeable. So for example, most people will say, I have a fear of flying, even when they mean they can't go near a plane. And conversely, people say they have a arachnophobia when they might just mean they don't like spiders. So the words have become interchangeable, but generally a phobia is you can't do it. A fear is just something that's kind of you dislike or you want to avoid.
So is it visceral? Is it like a visceral reaction?
Yes. Technically a phobia is an instant reaction. So they would, as I say, it's there's no filter between the thing, the thought, the image, and the emotional response. When a fear is a bit more, can have a bit more of a, well, yeah, maybe I can talk myself into it, that kind of thing. Anxiety is very similar, and a lot of fears and phobias are connected. So people that come to me and say, I have 5 different phobias, they tend to suffer from general anxiety as well. Now, anxiety is basically a lot of anticipation, is the fear of the future. So it tends to stem from of not feeling particularly safe or in control when you were younger, and so the whole world is seen as potentially dangerous or anything outside your comfort zone. That tends to be the definition, but I say it is kind of interchangeable.
Yeah, it kind of feeds into what we're saying about tokophobia, doesn't it, Alexia?
Yeah, and there are, and I think the one thing I find a lot with the people I work with is they're not able to maybe discern the difference between fear and anxiety, and these words are often used interchangeably. So when it comes to fear of childbirth and pregnancy, really, a fear, strictly speaking, is where maybe there's a perceived threat to your life in that moment, and that's when fear kicks in. Whereas anxiety is this future pace, it's imagined future. And so really when we think about pregnancy and childbirth, there isn't that immediate moment where you're going to now face a threat to your life. It's this, you're imagining the whole journey of pregnancy and birth. And so actually, when we're being strict with the definition of fear and anxiety, I'd say that really tokophobia is, we really should be calling it an anxiety, not a phobia already, based on that idea alone. What do you think, Chris?
Well, yeah, and reading your white paper, I think it's also that there's not one context-specific fear. So, and I talk about this a lot when people come to me. So even other phobias, someone can have a fear, what you call like a one-time learning. They have a bad experience, they stand on stage, get embarrassed and go, never again. It's one time in history. Anxiety is a prolonged period of not feeling in control generally. And so I think tokophobia comes into that category because it's more of a fear. It can be a fear of it can be several different phobias running at once. So one of the ones I don't know if this comes into it, but fear of the future as well, which is, well, what does this, after all the childbirth, well, what does this mean? Can I look after the child? Am I going to be a good parent? What if I mess them up? And there's all these other things that go into it, as well as the fear of the moment and the, fear of change, fear of the future. I'm going to have to sacrifice my lifestyle. So there's so many different fears that can compound it, which, I think would make it more of a anxiety disorder.
Yeah, the fear of change, fear of uncertainty, fear of losing control. These are bigger themes that expand much more than in a single moment. And you're right that, one the other thing I've observed is that I might be working with somebody that they're all focused about the pregnancy. And when I say to them, well, what kind of birth might you want? I can't even think about it. I can't even think about pregnancy. They can't think chronologically beyond the first stage in that journey. And then once we've healed the pregnancy stuff, now they can start thinking about the birth and going, oh, well, how do I feel about this now? But I wasn't able to even allow my mind to go to it, let alone parenthood. I mean, so then we have to kind of deal with the birth, and then they can start thinking about parenthood. So because of the chronology of this, and there's so much going on, that these different fears are almost stacked up against each other. And really they're anxieties, aren't they? They're kind of just, it's just a huge pile of anxieties lining up along that chronology that makes it I think is what makes it so complex. Yes,
absolutely. And I think the problem is, well, go into it, so you had your early days of psychology, you had your Freudian and everything. It had to be, your fears had to be somehow sexually related. And then you kind of in the 60s, you got behaviorism, which was, kind of challenge the fear and expose yourself to what's dangerous. That's quite hard with a lot of phobias, especially things like this. And then the sort of NLP type techniques, the clinical hypnotherapy became more mainstream, EFT, MDR, these kind of intervention tools came in, which is great. But the problem is they tend to just try and hone in on one specific thing. They don't tend to look at the roots. And a type of phobia like tokophobia is, as you say, it's compounded. So it's not just about going, okay, well, imagine that moment where you're giving birth and imagine happy thoughts. It goes a lot deeper than that. And so it's really getting to the root of what's at the base, what's the beliefs, what's the emotions, what's holding this fear in place. And if you've lived your life anxious, you tend to find things to worry about, because subconsciously, and it comes into secondary gain, the mind thinks it's keeping it safe. So it's like, I need to worry like I'm about to go into battle. So one goes away, and as you say, then the next one comes up, and it's kind of sometimes a bit like playing whack-a-mole with your emotions.
Yeah. And one thing I don't know what you if you've observed this, but what I've observed is those that have tokophobia, also they tend to have other things like severe anxiety or like OCD. And so would you like to speak to that, like this almost like clustering of things that are going on for people, and how they can navigate that? Because I think a lot of people, they find themselves feeling very overwhelmed. I've got this and this, and then they're seeing one person with this, and then they're seeing the OCD specialist with this, and then they're asking me permission if they can talk about this with the other person, and there's a lot going on for them, and I think it can feel quite overwhelming. What would you say to those people?
Yeah, well, I mean, kind of to my point is what's behind it all. So when you're anxious, you tend, as I say, the world is not a safe place. So your fight, flight, or freeze, your survival instinct has become overclocked. So you're looking for danger where there is none. You're trying to mentally rehearse all the worst things that can happen in order, again, subconsciously, not logically, in order to try and be safe or in control already. And so one of the things is to step back from that and go, what need is this behavior trying to meet? Because although it's not logical, although it's not rational, at the emotional level, at the subconscious level, everything is trying to meet a need. And so often when you can get to that and work on that point, a lot of the other sort of seemingly different fears can certainly be shaken up or reduced. Rather than sort of going top level down, it's getting to the root first, and that tends to impact people. But when people come to me, they often say, oh, I've got this phobia, and I've got this phobia, and I've got general anxiety, but I want to deal with this phobia first. And I always explain to them, no, because the anxiety is the roots that hold this fear in place. Till your body feels safe to let this go, you're going to just either the change will be temporary, or you'll create another fear. You'll find something else to worry about. So that's really the thing. Addressing the underlying root cause tends to be, I find, the most effective.
And what if you can't actually think of what that root cause is, Chris?
Well, this is where the, whatever you want to call it, mindfulness, clinical self-hypnosis, clinical hypnotherapy comes in, because every emotion, every belief, every feeling is in there. It's just getting to it. And the problem is, we often do know, but our logical mind gets in the way. So, they go, oh, well, that can't be significant because, that's not a big deal. But emotions don't work on logic. And a lot of these beliefs about protection or safety or being prepared were formed before you were, very young. And so you're acting like that 5-year-old, that 7-year-old. You're not acting like the adult. And so the one thing when I guide people to look for these solutions is to get out of your head, to let go of judgment and trust the answers that come up. And the more you get used to talking with your emotions, generally the more often the answers come. But I say the problem is a lot of practitioners are looking for one clear moment rather than more a belief, a period of time, which, as I say, for anxiety-based issues, it's more that than a specific trigger.
Mm-hmm.
I wonder if
Does that
that
make
would have
sense?
helped. Yeah, I absolutely hear what you're saying. I wonder whether that would have helped me, because throughout all the things that I went through before I realized I had tocophobia all of my life, it was always looking for that root cause. It was always looking for that one thing and being able to name that one thing. And I never could until I met Alexia. Yes. And then we realized that there was such a thing as tocophobia. Well, I realized there was such a thing as tocophobia, and that was the root. That was at birth, traumatic birth, and a feeling of being unsafe forever going forward until recently. And I would say that I'm not sure that I was a particularly anxious kind of person, but this thing had lodged in me, in my being, and had left me with that knot in my solar plexus, right? That never left me. That just feeling of not feeling safe, not being heard, all of these things which we talk about when it comes to tocophobia. So yeah, maybe that's really something which a lot of people might have found is not working for them, is trying to find that root cause, because you're so, it's so deeply embedded in you, you can't even recognize it.
Yes.
And unless somebody comes along and says, well, they're asking the right questions. How, what about your birth? What about this? What?
Yes.
You're not going to recognize that there might be something wrong with you. So does that sound about right? Yeah.
Yeah. Yeah.
Well, yeah, and the root also, like when we think about the root, for many in tocophobia might be their birth, but there's also, because it's a reproductive anxiety, anything around the reproductive system is also up for grabs. So which kind of explains why I often see puberty trauma surface quite a lot, because the same things are going on during puberty. Your body is changing and you're not in control of that situation. Your body is, nature is, whatever. There's a timeline at play that you have no idea what that timeline is. You don't know how your body's going to change. For guys, is my voice going to break at 12, at 15?
Yes.
Girls, like, what height am I going to be? How big are my boobs going to be? Like, none of that is known ahead. You've just got to kind of wait till you get spat out the other end. And pregnancy is like that. You don't know how your body's going to change, how you're going to respond, how any of that, if your baby's going to want to come out early, none of those things are known. And so this kind of aspect of uncertainty and not being in control of my body are parallels between puberty for both sexes, but also pregnancy. And so, but again, when you were born, you had no control, because you were being like, the mother's body was bringing you down the birth canal, whether you liked it or not. If you weren't ready, I mean, you look at the patterns and what's going on in each of those situations, there's a lot of common threads that we can point to and go, that's probably why I can't go near this situation, because it's bringing up this loss of control, this feeling of being trapped, this feeling like my body's changing and I'm not, and so I think what I've learned is I start to look for similar situations where these experiences are happening, to hunt down the root, because oftentimes when I work with clients and I go, I think you've had a traumatic puberty, they look at me like I'm gone mad. Like, what do you mean? Who thinks of puberty being traumatic, it doesn't kind of strike, not many people would have thought that that's a thing, you know. So I guess it's kind of looking for these clues, because a lot of the time this stuff isn't even conscious.
Yes.
Yeah.
Well, most of the time it's not, and I think exactly to your point, that's the fundamental difference between a phobia or a trauma and well, you could small t trauma, but big T trauma, and anxiety is that it's a prolonged period of time. So something like puberty is a prolonged period of time. So it's not one dramatic thing. It's just a period of time where you're uncertain and unsure, rather than looking for that one big thing. And to your point, a lot of people look for the related thing. Okay, so what else to do with pregnancy? Have I had fear? Oh, none. But it's not about that. It's about, when did I have that similar thought, similar feeling? It's not, the emotional mind doesn't necessarily work on literal connections. It works on emotional connections. And as you say, that's an important thing when working with clients.
I'm curious, have you ever had anybody come to you who has had a fear of childbirth? Has that ever, because I'm curious as to how many people actually would go to somebody who's an expert in this field saying, I have a complete phobia of childbirth.
So I have had people, but it's not the biggest one. And I would suspect that it's one of those that you avoid. So the people that have the fear will probably not even realize they have the fear, and do what a lot of people do, go, oh, I just, it's just not for me, rather than realizing it's actually a fear and just get on with their life. It's one that they can avoid. Obviously, they might start to suddenly go, well, wait a minute, I'm feeling a conflict here, but it's not as readily in your face as something like getting on a plane or getting up in public speaking. So it can remain hidden, and it's one of, there's some fears like that people think, oh, I'm fine, but they're actually lying dormant, and they're still affecting you. You're just not kind of aware of it like some others.
Yeah, well, that was me. Yeah,
that was both of us, wasn't it, JJ? Like, I didn't know I had this until I was staring at a pregnancy test, a positive, and then suddenly, boom, it hit me like a truck. So I wouldn't even, like, there's no way I'd go to a phobia expert to go, I'll clear my fear of phobia of childbirth. So as far as I was, didn't have one. I was like, I'm not maternal. Yeah. It'll happen.
Exactly that. That's not me. Yes, exactly.
Like, and I didn't know it had a name. I didn't know it was a thing. Yeah, I mean, it's one of these phobias that's been like lurking everywhere in plain sight, and yet no one knows it's there. It's crazy.
Yes.
Yeah, and I had the same experience as you, looking at a pregnancy test, a positive pregnancy test, and had exactly the same abject terror shooting through me. Had a miscarriage soon after that, but never got to the point of thinking, well, there's something wrong. I just kind of completely pushed it out of my head, completely pushed it away, thinking, oh, well, so life goes on, right? That happened. Back to not having babies, right?
I mean, but won't do that again.
Won't do that again. Yeah. So it was just extraordinary, but it was a huge thing. But I still was able to say, yeah, that's just, that just nothing happening there, just move on.
Yeah, and I think actually when I had that experience, I was like, right, it must be my anxiety off the chart. I'm going to go work on my anxiety. It didn't even think, oh, phobia, right? I go, because I was training in NLP and all those things. I knew loads of people that did phobia at the time. I could have easily gone to see somebody, but even at that point, I wasn't recognizing it for being a phobia. I didn't know what I was actually living through. And isn't that crazy? Like, if you were going to catch a plane and suddenly you were like having a bit of a moment, in that moment you go, oh, right, okay, I've got an issue with planes, I better go. Suddenly you click and you go, right. But I didn't even click when I was going through it. You didn't.
Neither did I.
And we were like, we'd been training in this stuff. We really should have known better, and we didn't, right?
Oh, well, that's always the plumber with the leaky tap. It's always easy to spot it.
Totally.
Training and all of this kind of stuff. We all knew how to, deal with phobias, help people get over their phobias. And yet I had buried this thing so deeply, that it just wasn't appearing to me in any, despite the abject terror when I saw this pregnancy test, and despite the anger I felt this extraordinary anger after I'd had the miscarriage, and I didn't know why I had that either. but just thought, oh, well, that's just maybe how people react to having miscarriages. On we go. Life goes on, back to work. And had no idea. But when I heard that there was such a thing as tocophobia, and I understood what can cause it, suddenly it became so clear what was going on, what had been going on. It was extraordinary. So there's something I think about being able to name and see something. So with a normal phobia, like fear of flying, spiders, you see the spider, you see the snake. Yes. You see the plane, and as you're about to take off, and you've got a white knuckle right ahead of you. With tocophobia, you don't see anything, and you don't even know a name that would even relate to it. So I think that's key as well.
And I'm curious to ask about some other fears, because there's a fear that I come across all the time, which is the fear of being sick, emetophobia, or the fear of vomit. Is that something you come across a lot in your work?
That is definitely a more common one, yes.
Yeah.
A lot of people have that, and that tends to be, well, it can be linked to germs, but most commonly made to felt ill in the past, and you want to avoid it. Basically, that's normally quite a context-specific phobia. But yes, it's a very common one.
Is it? And is that the often the route then, that you've seen somebody be sick, and so now you don't want? Is that because
someone be sick
so obvious and too easy?
Well, sometimes it is. It doesn't have to be. I always say, and that's again going back to all these amazing tools. There's some great tools out there, but when you learn them, especially in short courses, it tends to be very prescriptive. It tends to be, if this, then this. So as I say, CBT, okay, well, challenge the phobia or whatever. NLP tends to, run it backwards, put it on a cinema. Now that can work. And if you've got the trigger and you know what it is, that can work very well. But it depends. Sometimes if someone it tends to be around illness. Most often sickness can be around illness, but again, it also can be linked to loss of control. A lot of sicknesses, you're not in control of your own body and things like that. So it can also be an anxiety issue. And that is why, and I'd always talk about this with clients and practitioners, is it's important to get precision on what exactly is going on for the individual, not go, if it's sick, it means this. If it's this, it means this. And actually ask the client and tailor the treatment, the approach to that individual client to find out, well, what are you going on? One of the things I often say is, teach me how to do it. What are you thinking about in that moment? What are you feeling? Okay, where does that feeling come from? What's your earliest memory of feeling that way? So yeah, it can be very specific, or it can be very general. It really does depend on the individual, but sometimes it is a very specific event.
Well, the sickness one is very common, because a lot of women that fear pregnancy, they think, well, I'm going to get morning sickness. And so that is often one of the first phobias, fears that's presented, because it's an obvious kind of, I think it's an easy one to isolate and spot, whereas a fear of losing control is not really on people's radar. That they're gonna,
it's not really, it's not really, people don't say it either, because and again, there's no polite way of asking, hey, are you a bit of a control freak? So, but there's certain questions you will ask. So if you were driving a car, do you prefer to be the passenger, or do you prefer to be driving? If you were, so there's certain questions you can ask to ascertain their high need for control in general areas of life as well. But
and
certain language you can use.
I want to talk about medical fears as well, because that's another, a lot of women with tocophobia have got a lot of medical fears, and this one I had an injection phobia, so I'd never leave a doctor's upright. I'd always faint, and so or even just the white coat syndrome, that kind of fear of medical environments. And so is that not one trick pony, but is that a singular easy one, or is there more going on there with the medical fear? What are your thoughts, Chris?
Again, it can be either. So it can be, what's the common ones? Oh, I hurt myself when I was 4 years old, in hospital in pain, looking at all this white thing, and it's what the Pavlovian response, which is you ring a bell, feed a dog, ring a bell, feed a dog. You have a negative experience, and you have a visual. When you see that thing again in future, you fire off that emotional response. So if you're in pain in a hospital, or you had, for injections, the most common one is the nurse messed it up when they were young and they ended up screaming the place down, and then their emotional mind, their subconscious has held on to that. They might not consciously remember it. So it can be things like that. It can just be, yeah, a general dislike of hospitals from a prolonged period of having unpleasant experiences. But yeah, that it can be either, but more often than not, that tends to be a more specific one that can be isolated and worked on. Sometimes it's a fear of the fear itself. So for people who have had blood and passed out, again, that comes back to control and, oh, well, what if I pass out? Well, what if you do? Oh, well, I'll embarrass myself and everyone will look at me and I'll feel small and I can't do that. I have to avoid. So yeah, there's all sorts of beliefs that can be compounding it.
And I'm glad you mentioned the fear of the fear, because this is called phobophobia. And
yes,
that's surprising how much that comes up with the people I work with, is the fear of fear itself.
Yes.
And how, and yet a lot of people don't kind of think of that as being a fear.
No, well, I have a whole section on it in my book, which is step 7. It's the final session, and that comes very much with anxiety as well, which is if I can just figure out everything that can go wrong, I'm ready, I'm prepared, I'm safe. Not realizing that you don't catch an emotion, you do an emotion. So the more you're focusing on all the worst case scenario, the more you feel it, the more you picture it, the more you shrink down, and then it's just like that thing happened 100 times in your mind. But yeah, it often stems from a belief that you're not allowed to have emotions. So the most common, this is very common in men, is that somehow if I get anxious, if I, look silly, if I get embarrassed, then I'm somehow weak and everyone will look down on me and judge me. So you create a fear of your own fear. Now, again, logically, you would think, oh, well, if I don't give myself permission to have an emotion, I just won't do it. But it's the opposite of that. It's like saying, don't think of a blue tree. Whatever you do, don't think of a blue tree. The more you try not to have an emotion, the more power you give it. And it creates like that pressure cooker effect. So yeah, it's very common, and it comes with the anticipatory anxiety, these kind of things. It's that need to try and control yourself and fear of your own emotional responses.
And what would you say is, like, when I think about fear, I think fear is, I often think of fear as like an entity almost, and it's trying to defend its turf. And if you get too close, it's going to bring out the big guns. I don't know, like, is that something that you see in your work? Do you see, like, the minute you get close to it kind of gets strong? It's like trying to protect itself almost.
Yes, absolutely. Well, this comes into what's called secondary gain, which is the benefit for the emotion. Again, logically, I'd ask a client, what's the benefit for feeling this way? They'd go, nothing. But if it didn't serve you subconsciously, you wouldn't be doing it. And so, as I've said, I need to be ready, I need to be protected, I need to be safe. And so one of the things you can do is to imagine that part and actually negotiate with that part. So you go, okay, if this anxious part looked like a person or an object or a thing, what does it look like? And then you imagine sort of going, okay, and what need is it trying to meet? Oh, it's trying to keep me safe already. Okay, and then you have a little negotiation with it and go, well, how safe already do I feel when I'm freaking out, panicking, and so when you can kind of negotiate with yourself, as weird as it sounds, so that can often take out the power. But yeah, so it is realizing that you don't catch it, you are doing it. It isn't a monster. It feels like it. It's something outside. It's not outside of you. You're creating it, but also that part within you is trying to meet a need. And when you can find better ways to meet that need, often the pattern will drop away. So it's learning how to work with that part, which again, we often don't, because it seems so weird, because logically you just go, you're trying to fight it or cut it out or go, no, go away, I don't want it. And none of those things help you feel better, because you're fighting with yourself effectively.
Yeah.
Make sense?
Yeah, totally.
Yeah, absolutely. Yeah, it does. And I'm curious now, because we talked before a while back about tocophobia, and it was not a word that you had really heard before. And I find that a lot of people have never heard of it. What are your thoughts about tocophobia now, and how do you think that's going to impact your work going forward?
I mean, I think it's definitely given me more areas to look at with a client. So I think I would probably, and I think it was something in the white paper, be looking for 2 or 3 patterns when, as you said, there could be 40. So being a bit broader in where I guide the client and not limiting them. But yeah, I think sometimes the label is useful because you can recognize it. Sometimes the label can be limiting, but I think it's definitely one a lot of people haven't heard of, including myself, who was, dealing with phobias all the time. I've heard people say they have a fear of pregnancy or a fear of, responsibility or those kind of things, but never specifically that. So it's a good one to know.
And do you think
Yeah.
guys, have you ever had guys that have come to you saying, I'm just when the time comes and the baby's got to come, I don't know if I can get in that hospital room with her. Can you help me to be okay with getting in the
Yes.
room, the birth space?
So more often than not with men, and this, I don't know if this is, again, I don't want to put people into boxes, but this is my personal experience. The male fear tends to be more about long term. How it's still that kind of old fashioned idea. How am I going to provide? Am I enough? Am I ready yet? What's this going to mean for my career? They often, males, for whatever reason, tend to think more in those kind of practical terms, those kind of fears, rather than the birth. But obviously, if they have white coat syndrome, if they have fear of blood, fear of needles, that's going to affect them too.
Yeah, there's a lot of clients I've had that want to have home births, and then they're like, well, I don't know if my husband's going to let me do that. I think he wants me to be in a hospital. And I'm like, okay, so now we're dealing with his fears, not yours.
Yeah.
Yes. Yeah.
Right?
Absolutely.
So, it's important, I think, for women going on this journey to kind of bring their partner in and understand what their fears are, because obviously they need their partner there to support them in whatever birth choices they have. But sometimes the partner can't support them in the way that maybe she needs him or her to do because of their own fears. And so I just wondered whether any of that had hit your radar really in terms of that whole giving birth piece. Because I know I've had experiences with there's a guy I hired to do some video work, and I'd started talking about my work, and we were 20 minutes into the shoot, and he's like, I can't listen to any more of this. I think I'm going to be sick.
Yeah, I need to sit down. Yeah.
And so he clearly had a really bad phobia about listening to that kind of to anything around birth.
Yes.
And so,
Yes.
I'm curious as to whether or not you've come across men that have shared this with you, because again, we hear about a fear of pregnancy birth and just think, well, that's got to be a female thing. But maybe, maybe it's not. Let's throw it open.
Well, I think there's a lot of people that will, even in a therapy session, will feel kind of fear of the fear, will feel embarrassed about like, everyone goes, oh, it's the best. Oh, kids are amazing. It's the best. And of course they are great, but it's also a massive change and a massive responsibility. So the number of people that do kind of go, look, I don't want to say this, but I'm a bit worried about what this means. I feel I'm losing. Am I going to lose myself? Am I only going to be known as the mother of, there's all these things that can compound it. And I think often we've created this idea that because you should enjoy it and it should be magical, that there's a lot more guilt about expressing some of your fears as well. That can often come in.
I think that's huge, actually. It's really huge. Yeah. And speaking as somebody who has been that person who didn't really want to talk about it because you're going to be judged and people think you're weird. And what do you mean? Yeah, you're not going to have children. Oh, well, you just wait because it's going to happen to you no matter what kind of thing, Well, don't think so. And doctors, people in the health professions, saying, oh, well, just go away and have a couple of kids, you'll be fine. No, doesn't. It's just, for some of us, it's just been impossible to talk about. And I think that's one of the things that we need to really address. Allow people to talk about their fears, to talk about their anxieties, and not judge them, because it's actually quite normal.
And I think this is the thing, and it's important to realize emotions aren't logical; they're also not proportional. And a lot of people have a lot of guilt about some of the fears they have, some of the emotions they have. And as I say, some of these things may have been created, as you say, when they were born even, but certainly 2, 3, 4, 5 things you wouldn't even consciously know about. And it's like you're still thinking like that 4-year-old kid or that 0-year-old kid. And so it's letting go of the judgment and just go, this is what's coming up. Because pretending it's not there doesn't make it not there. As I say, it actually creates more power. When you can acknowledge it, when you can work on it, you can actually let it go. So even if you think you are being unreasonable, the best way is to work on it.
Yeah.
And one of the things I hear a lot from women is that how can something that I've had all my life be cleared so quickly? And it is, and I'm sure you work very quickly with people. And so what would you say to those people that are like,
So I give the analogy. So the common one is, and especially for a context specific phobia, is if you love dogs. Love dogs. One day you get your hand bitten off by a dog. Split second, you go from love to fear. If you're in love, find out your partner's cheating on you. In a second, you go from love to anger, love to hate, potentially. the brain with enough negative association can learn in a split second. And so often, as I've said, while it may be a prolonged period of time, it's not all your life. So it's a period of time where you've created these beliefs and your mind is going back there. So you haven't had it for 30, 40, 50 years. What you've had is some bad experiences that you've been repeating for 30, 40, 50 years. And so going back to the, if you, with enough negative association, you can create pain. With enough positive or neutral, you can also create pleasure. So it's just to do with how the brain is linking it and getting out this idea that a fear and emotion, one is a monster and two is part of who you are. Because that's the other thing that often comes with secondary gain is the idea, well, who am I without this? Would I recognize myself? And of course, the answer to that is, well, who are you when you've been the most relaxed? Are you more yourself or less yourself? Oh, I feel more myself. So it's realizing that this isn't it's not your identity. It's just a pattern, and it's a wrongly learned pattern to keep you safe, which is great if you're being attacked by tigers. It's great if you need to battle against attackers or whatever, run away from attackers. And once your brain learns that there's a better way to meet this need, it can let it go. That tends to be my advice.
Very good advice.
Yeah, it is. It is. Well, so I think I've learned a lot about phobias just talking with you today about them. I think it's really important to understand that it's not you. We are, one is not out of the ordinary. You are just doing what you can, given what you're given in life. And there is absolutely no reason for people to judge that. And I think if we get that message out into the world, I think that's really important. And, the things that you've said today I hope have really helped with that as well. What do you think, Alexia?
No, absolutely. I think if you can realize that it isn't you, that it's just what's happening to you, and then you can change what is happening to you and become somebody without that thing. So because people are broken, and actually because this is far more widespread than a lot of people realize. And one thing that I get is once they realize that it has a name, and then they find whole communities of other women that are also suffering with this. That's a huge part of the healing journey already, is realizing that they're not just a broken person, that is unique with this challenge, with this fear. So that's a huge step already, being able to name it and realize it's not you, it's just something that you've experienced. So Chris, this has been fantastic. And now if anybody want to find out more about you mentioned your book, so tell us what the name of the book is and where we can find out more about you.
Yeah, quick plug. It's called Face Your Fears. It's available in all good bookshops. It's available on Amazon and Kindle and Audible as well. So if you're more of a listener like I am, you can do that, or you can find my website, christopherpauljones.com.
Wonderful. And you've got in-person clinic, haven't you?
Yes, so I work with people like this over Zoom, or I can work with people in Harley Street in central London.
Wonderful. Well, thank you so much for joining us today.
Yeah, You're welcome. Thank you so much. It's been great to see you. Thanks.
Thank you for having me.
Well, a big thanks to Christopher there. It was really great of him to join us to have this conversation about fears, phobias, anxieties. I hope that you found it enjoyable. Maybe you learned something. I know I did. And, please do like and subscribe if you want to learn more about this subject. Tokophobia affects millions of people worldwide, and half of us don't even know that we're suffering from it. Anyway, for now, thank you so much again. Do all the YouTubey things, and we will see you on the next one, I hope. Take care until then.